everyone, this is Dr. Pavana, Psychiatrist from Jyotsna Hospital. Every year, May 31st is observed as World No Tobacco Day, and this year's theme is Threat to Our Environment. Globally, almost around 8 million people are affected by tobacco. This year's campaign is to raise an awareness about also an impact on the health tobacco is causing and also towards the environmental issues it is causing to us. 3.5 million hectares of land is destroyed due to tobacco growth. Why? Because it causes some soil degradation which leads to not suitable for any other crop for cultivation, and also it adds on to a global warming, and due to this it adds on burden to the farmers and also leading to an suicidal deaths in the farmers. Around 8.7 million tons of carbon monoxide is released globally due to smoking or this tobacco use. You can know that manufacture 400 cigarettes, almost one tree is sacrificed. Now coming back to Indian statistics, India, which is a developing country, adds on to the second most largest country who manufactures and who consumes and exports cigarettes or tobacco use. Tobacco use not only causes an impact on our physical health but also has a toll on our mental health. We all know that it increases the risk of cancer, from lung cancer to esophagus, head and neck cancer, and also it increases the risk of cardiovascular diseases, stroke, diabetes, hypertension, and etc. Coming to mental health issues, tobacco use is known to cause an addiction, and addiction is nothing but a mental health disorder. So what causes an addiction in tobacco? So whenever a person smokes tobacco, there is a chemical called as a nicotine which enters his lungs. Through his lungs, it gets absorbed into the blood and it enters into the brain, where it activates what is called as an pleasure hormones, which is called as an endorphins. And this activates, which is a reward mechanism. Like you must have seen, whenever we have a nice cup of a coffee or we have any hobbies which we enjoy, we have a pleasure doing those activities. The same holds good when the person smokes cigarettes or uses tobacco. These happy hormones called as an endorphins, when it causes something called as a joyfulness in his mind, where he perceives it to be relieving his stress. So henceforth, he now from one cigarette he starts on to, it goes on from 1 to 2, 2 to 3, and becomes a chain smoker. So this leads to addiction. Now once the person is addicted to cigarettes, is there any chances to quit smoking? Is it very tough, or it can be easily quit? This is a lot of questions people ask or patients ask. Is it very difficult to quit smoking, or how tough it is? There are a lot of ways to quit smoking. There are nicotine replacement therapies which is available, gums or lozenges, patches, and there are a lot of tablets which are available which we use, which help people to quit smoking. Just tablets or any nicotine replacement therapy would not be sufficient for a person to quit smoking. It needs a lot of determination and a will to stop him smoking. Here in Jyotsna Hospital, you can consult professionals who can help you to quit smoking. Coming back to this year's theme, it is to protect environment. By a person, we have to take a responsibility to quit smoking and also to protect our environment. It is everyone's responsibility. Thank you.